PSA is a blood test. It's called prostate-specific antigen. In fact, PSA is a protein that is produced by every prostate. Every man has a prostate, and every prostate produces PSA. Some amount of that PSA leaks into the blood, and that we can measure. So there are many conditions, prostate cancer included, that cause the level of PSA to go up in the blood. It has been used as a screening test for men in that age group to see if they have a higher risk for prostate cancer. And if the PSA is high, traditionally, this has been followed up by a prostate biopsy to confirm whether there is cancer or not.
Something that is an extremely common situation in men is benign enlargement of the prostate, also called BPH or benign prostatic hyperplasia. BPH occurs in men as they get older, and it leads to urinary problems, including difficulty to pass urine, frequency of urination, urgency of urination, waking up many times at night, sometimes even leaking before you can get to the bathroom. And this can impact the quality of life of patients. There are a different class of medications which can be used to help with those symptoms. And if medications don't work, then surgery is also an option.
When the prostate is really big, that obstruct the lumen of the urethra and then makes you pee many times at night, weak urine stream, you need to strain to pee. The usually treatment, when it's too big, the standard treatment was open prostatectomy, where a small midline incision, we went in and we removed the internal part of the prostate, what we call the adenomectomy. 15 years ago, I described the technique, how to duplicate the same open approach robotically. At USC, we have one of the maybe world bigger experience doing this robotic simple prostatectomy. And basically we go in, now also we can go inside directly with the bladder with the new robotic platforms, and we remove the internal part of the adenoma of the prostate, and then we bring the bladder down to the urethra. That's a big advantage for really big prostates. When the prostates are not that big, there's many other options that we can do through the urethra. But when the prostate is really big, more than 150, 200 grams, the option is going robotically. And at USC, we have a huge experience doing robotic simple prostatectomy.
Aquablation that was FDA approved almost 6 years ago is a very promising new treatment for treating BPH. There are two essential components of aquablation that are different from most other surgeries for BPH. Firstly, it is image guided. It is done under ultrasound control, and it is done robotically in an automated fashion. Secondly, unlike almost all other procedures that use some form of heat, lasers, electrical energy, etc., aquablation uses a water jet which has no temperature. So there is no heat involved, and so many of the side effects of this procedure are reduced. So one, it is able to treat bigger prostate glands, and number two, it minimizes the side effects, especially on sexual function.